Health Hub. Unlock your total health and fitness potential. Welcome back to Health Hub. If you're looking for daily hacks on your health and fitness, make sure to like, share, subscribe, and tap the bell icon to be notified of our newest videos. In this video, I'm going to share with you intermittent fasting and how it works. If you're new to this eating pattern, don't worry, I've got you covered. Intermittent fasting is an eating pattern that focuses on when you eat, rather than what you eat. Instead of spreading out your meals throughout the day, you have specific periods of fasting and eating. It's not about strict calorie counting or food restrictions, it's all about timing. There are various approaches to intermittent fasting, but let's start with the most common one, the 16/8 method. This involves fasting for 16 hours and having an eating window of 8 hours. For example, most people choose to skip breakfast and start their eating window around lunchtime until 8 p.m., consuming their last meal before the fasting period begins again. Another method to consider is the 5-2 method, also known as the fast diet. With this approach, you eat normally for 5 days of the week, while limiting your calorie intake to around 500 to 600 calories on the remaining 2 days. These fasting days do not have to be consecutive and can be spread out during the week, allowing for more flexibility based on your schedule. Moving on to the Eat Stop Eat method, which involves fasting for a full 24 hours once or twice a week. For example, you may choose to eat dinner on Monday and then fast until dinner on Tuesday. During the fasting period, you are allowed to consume water, unsweetened tea, and black coffee. This method provides a longer period of continuous fasting. Next, we have the alternate day fasting method. As the name suggests, you alternate between fasting days and non-fasting days. On fasting days, you consume very few calories, typically around 500 to 600 calories, or you may choose to have a full day water fast. Now, let's discuss the one meal a day, or the OMAD method. So what exactly is one meal a day fasting? Well, as the name suggests, it's a form of intermittent fasting where you consume all your daily calories within a single meal, typically during a 1-hour eating window. The remaining 23 hours of the day are spent in a fasting state. If you're new to OMAD fasting, it's best to gradually transition into it rather than diving in headfirst. Start by compressing your eating window, such as consuming your meals within a 4 to 6 hour time frame, and gradually work your way down to one meal a day. Lastly, we have spontaneous fasting. This approach is flexible and doesn't adhere to a specific schedule. It encourages you to listen to your body and fast whenever it feels natural or when you're not hungry. You have the freedom to skip a meal or extend your fasting period based on how you feel. Spontaneous fasting allows for intuitive eating and adapting fasting based on your body's cues. Remember, before starting any new diet or fasting regimen, especially if you have underlying health conditions, it's important to consult with a healthcare professional. Which of these methods piques your interest the most? Let us know in the comments below. Don't forget to like, share, subscribe, and tap the bell icon to be notified of our newest videos, and I will see you in the next video.